social care is always presented as a sort of Cinderella. People always, we're sitting in the King's Fund, aren't we? People sort of start from the NHS and then they kind of look out over there somewhere to social care. What I found was I think the NHS has a lot to learn from social care. Social care quite often is very entrepreneurial and very innovative. And it's one of the points I wanted to make, that I hope that any form of integration does not lose that. Because there is a danger in sort of top-down integration that you create something which is rigid and actually loses some of the things that are being pioneered now, particularly in terms of being responsive to people and really giving the kind of care that we would all like to see. They're being pioneered in social care, and they're being pioneered in very small places on small scales. And it's whatever solution you end up coming up with, I think it's very important that we don't lose sight of that. In this sort of mass of quangos that we now have, and brilliantly depicted in the King's Fund animation, which I still send out to people who ask what on earth is going on. It's by far the best descriptor of what is going on in the system. It's not clear to me. I think you mentioned health and wellbeing boards, which are obviously barely functional. It's not at all clear to me who is going to commission this stuff. It seems to me that local authorities are understandably under enormous pressure in the way they commission social care, but they are not commissioning very well, and as we all know, commissioning by the minute is really not working. So I'm not sure if that really is within your terms of reference, but clearly somebody has to be answering that question: is who is this going to sort of lie with? We can get a huge amount of efficiency in the system, but at the end of the day, more and more of the conditions and the chronic conditions that we're seeing, yes, some of them can be managed at home and some of them can be managed by telehealth. We need the patient, the service user needs that person to be responsive to their need. And there is only so far that you can squeeze the amount of hours that the individual needs from that other individual. It's about health and social care. It's fundamentally about relationships. And we currently have an absolute crisis in social care because many of the best people are giving up. They simply cannot keep going, trying to provide care, not being allowed to provide decent care. And these solutions are all great in the long term, but there is also a sort of short-term crisis there. My other concern about commissioning singly, I suppose, is just that top-down systems make an enormous requirement on the front line. So the excessive request for data, for example, and I'm very conscious of this on the CQC, which obviously is one of those culprits. If you're running a chain of care homes which crosses England and Wales, I think you have 11 different bodies which are asking you for data. So again, any new system has to look at that. You should be asked for the same piece of data only once. I actually think on the funding, you're going to need all three options. And I think that to present all three options together is much more powerful because it slightly gets you round this problem of not wanting to extend charges within the NHS, because it just shows how big the problem is, I think. I do think efficiency is essential, and I do think there are a lot of patches in both NHS and social care which are doing phenomenal things and saving phenomenal amounts of money. The thing that we need is much more, is a better way to spread best practice. The thing that drives you crazy looking at the NHS from the outside is that there are just these fantastic examples of wonderful care and wonderful treatments and all the rest of it. And the best practice just sort of sits in a King's Fund report, or it doesn't seem to translate across the system. So again, if you're going to integrate, you need that driver. You need people to sign up and say, actually, we are willing to sort of come out of our particular silo and look at what's possible. I think we're at a very interesting point at the moment. Particularly in the health service, because it's obviously better understood by the public. People are just beginning to clock, the point Jackie made about actually it might be better to have our hospitals reorganised. These things this debate is just beginning to percolate, and people are now really worried about their own care, and they are more open, I think, to these kind of questions. So I do think there is some scope for extending charges. And one of the other things that struck me recently is so many nurses have said to me how infuriated they are that the public doesn't know the cost of anything. And one nurse said to me, why don't we just put the price on the packet? Yeah. If you go to the doctor and you get antibiotics and you kind of can't really be bothered and you throw away through half the course, it's 30 quid. It's 30 quid. But I bet you didn't know that, did you? You don't think about the cost of it. And a lot of nurses saying, people take equipment and then they don't bring it back and all that stuff. And people have, and of course, when you go, especially when someone dies and you go into their home and you find these shelves upon shelves upon shelves of pills and tablets, which then can't be reused. There's a lot of fury within the system about waste. So there is something, I think, there is a narrative that suggests that small charges for things make people value a service. And on tax, I agree. I'm attracted to the idea of hypothecated taxes, even though, of course, treasuries always hate them. I'm very attracted to the idea of sin taxes, and we're all in that territory at the moment, aren't we? Now we're all sort of terrified about what we eat and so on. Obviously, the problem with taxes that try and change behaviour is that if they succeed, you don't raise enough revenue, which is a bit of a problem with that. But I'm quite attracted to that. I think the point about pensioners, rich pensioners, yes, that's the way the political debate is moving as well. I'm sure some of those things will be means tested. It's not far off. There's a quite clear connection there. I personally actually do agree with you that inheritance tax should be raised if you can get around the tax avoidance. I think that's quite a powerful one. But where I do worry is about taxing pensions. There seems to me there's sort of moral hazard there, because presumably what we want is for people to save. And there's a huge danger in all this, of course, that we've got to we've got to make people more responsible for their own health rather than less. So I think you don't want to create any disincentives for people to save for their old age, and that's the economists in the room are much more intelligent on that than me, because ultimately. And I take your argument that the economy will grow, and so even if we need to spend more, it'll be a share of a larger pie. Really, if you look around the system, particularly in social care, it is cracking at the seams. We need to spend an awful lot more to make it better. And there really is a limit to how much we can spend. So I think, society is going to have to accept that we all need to take more responsibility for ourselves and also responsibility for our relatives.